Very warm welcome to the students and the faculty members. Today there is another section regarding the drugs acting on the CNS, that is your central nervous system. So one of the very good drug that what we're going to see here is like Ashwagandha. Ashwagandha is one of the very oldest drug which is maintained in the oldest form of drug that which comes in Ayurveda, especially meant for which is a very good nervous stimulant, and also it is being used with various other purposes. So today we are going to see a very extensive role of what is Ashwagandha in the herbal formulations. So myself, I'm Ashwagandha, working as an associate professor with the Department of Pharmacy at Sri Sharma College of Pharmacy, Salem. Coming up for the topic, today we are going to see about what are the drugs which acts on the central nervous system and improve its nominal disorders and other functions. So the drug that what we are going to see is here is Ashwagandha. So normally the Ashwagandha, which is the entire plant, we are going to take it, and also especially we are going to take about the roots. Understood? So it is a biological source which is obtained from the species called as Withania somnifera. Understood? So here we are going to see about what is the plant profile and also with the root. So normally the synonym that what we're going to see is like of the Ashwagandha is Withania root. The biological source, it's a dried roots. It's a source which are obtained from the dried roots on the stem basis of the species called as Withania somnifera, belong to the family Solanaceae. So most probably you can see the source, the geographical source, which is you can see found in the African countries like Congo, South Africa, and also with the Mediterranean countries like Egypt, like Jordan, also in Pakistan. And in India, you can able to find out in extensively in the Madhya Pradesh, also in Uttar Pradesh, and in some parts of Punjab, Gujarat, and also in Rajasthan. See, you can see the plant picture on the right hand side. It's a very common plant which is found in the Madhya Pradesh and UP, and also in some parts of the northern parts of India, and also in the western part of the India, like Gujarat and also in Rajasthan. So normally the cultivation and collection and also with the preparation of this Withania somnifera, so it is done by sexual reproduction, that is called as through broadcasting method. There the seeds are very small in size, so normally the seeds will be mixed with the sand and which will be thrown in the month of June to July. So normally about nearly 4 to 5 kg of seeds are required per hectare. So that's the size of the seeds, where the size will be very small in size. So they have to be mixed with the ground soil or the sand or any things, so that the even distribution of the thing, and then they will be sown into the sown like as a broadcasting method. So normally after the sowing the seeds, the plant, it takes nearly about quite some time to bear the fruits, and it flowers in the month of January. So harvesting will be done up to the month of March. So from the season where the flowers which comes out, and after it, the flowering takes place, you can go for the harvesting, and it will be done up to the month of March. So India, it is mainly cultivated in the district of in the state of Madhya Pradesh. See here, you can be able to see some of the diagrammatic representation of the picturization of the roots. So normally the size of the roots, the length will be around some 10 to 17 millimeters, and the width will be around 6 to 12 millimeters. The shape, it will be present in either in the conical shape or cylindrical shape, or to some level of straight things with unbranched. so you cannot able to see the rootlets or something like that with the roots. So normally once you look into the fractures are nothing but the cracks. Once you see it, you can able to see it, the fractures are very smooth, and also it will be present in the powdery form. Next, you are going to see about what are the morphological characters. Morphological characters are the characters which we are able to see it, the outer part of the root. So the root, once you look into the color of the root, it will be grayish yellow in color. In odor, the smell will be a faintly pungent, a distinct smell, and also with a characteristic one. Next to the taste, once you taste it, it will be like a mucilaginous one, like a soapy form. Also like an acrid, it will be having a very pungent things, and also a bitter one. So coming up for the extra features, what you see in the root, the center of the root will be in the creamy color. Will be very in the creamy, and also it consists of soft. So somewhat it will be like in a semi-solid with a solid mass with a scattered pores. So here you can see able to see the pores are scattered on the center part on the sideways. So coming up for the chemical constituents, normally you can able to see most of the things that we see in Withania will be based on the alkaloidal contents. So the first important alkaloidal content is like aniferin. Aniferin is one of the very good alkaloid which is used in many things, which is also useful for many activities or therapeutic activities. The next one is like Withanin, which is also plays a very good role in many therapeutic activities. Next one is tropin. Mostly you will know that this is one alkaloid which is coming from, which is also present in the atropa. Next one is anhydrin, which is also a very important alkaloid, which is used to have many therapeutic actions. Next one is cocohydrin. This is also plays a very important role. So next one is choline. Choline is one of the precursors used for formation of acetylcholine. So the chemical constituents, apart from the alkaloidal contents, we can be able to see the steroidal lactones like withanolides. Next one will be withaniferin. So withaniferin will be divided into two ones, withaniferin A and also withaniferin B, which doesn't have a very big role in terms of this therapeutic activities, but withaniferin A, it is called a very good role. Next one is withanone, which is a typical lactones, which also plays a very distinctive roles in the therapeutic activity of this Ashwagandha. The alkaloids are the contents of this Withania somnifera. Next, we are going to see what are the uses. The most common uses that we are going to see is it is used as a sedative, and you know what is the role of sedatives. So sedatives normally it causes some drowsiness. Also, it is used as a kind of things which is used for the sleeping purposes, just sleeping pills. So the main use is it is used as a sedatives, and also it is used as an hypnotics. So normally to see what is there within your brain, this drug is very useful for the proposal of this hypnosis. Also, it is used as an hypotensive, means the reduction of your the blood pressure. And the next one will be used as which is used as a respiratory stimulant action along with the bradycardia. And the main uses that what we are going to see here, it is used as one of the drug of choice used for immunomodulatory. That is, it increases your the immune system, and also having a lot activity on anti-stress that which controls the stressful needs of your brain. Next, also it is used in the treatment of rheumatism. Many people know that in osteoarthritis. Also in the treatment of gout and skin diseases. Widely used as the sex stimulant for the conditions of libido, and also used as a strength and vigor promoting drugs, especially with the geriatric cases. So normally most of the drugs that we are going to see is here what happened, it will be taken in the case of old ages. Vithania, a steroidal lactone, shows a very good activity on the anti-tumor activities. Normally it is used as the treatment of leukemia or characters like in the treatment of the cancer. So then comes what are the allied drugs or the similar drugs or the adulterants which is used to mix up with the original ones. Allied drugs is Withania coglinase. The adulterant is wild Ashwagandha. Understood? So these are the drugs which look similar and also used as an adulterant. So thank you for this wonderful session, and we'll be seeing on the we will be seeing on the next session. Thank you for your wonderful time.